welcome back to another session of Q&A. We have a lot of questions to cover, so let's jump right into it. Today's question, or one of the questions, is why my temporary crown is rough. So temporary crowns, remember, are made of plastic. They are not made to last that long. If we cement a temporary crown with a temporary cement, it's supposed to last about 2 or 3 weeks. If we cement temporary crown in certain situation with permanent cement, it will last you about 3 months maximum, give or take, depending on how you care for it and depending on your habits too. The reason why it's rough, we polish them, we can stain them if you want to get really, really fancy, but that doesn't last because you are polishing or you're sealing or you're staining plastic surface. And plastic surface is very porous, but it's not the best surface to glue anything on or add anything on. So we try to make it as aesthetic as possible. And again, if it is too rough, we'll polish it for you. But that's the reason why, because it's just plastic. All right, the next question is why my crown keeps coming off, whether it's a temporary or a permanent crown. So there are many, many reasons why crowns will come off. The first reason, if the glue get washed from underneath the crown and there's no glue, so nothing is holding the temporary or a permanent crown to the tooth, it will pop right off. If you are very hard on your teeth and you're biting a lot of sticky object or you're biting into very hard object, again, crowns are made of plastic. They will crack very easily. They're not ceramics or even porcelain. Those are a lot stronger material and it can take on the pressure of biting and the pressure of mastication. Again, temporary crowns are not made to last that long. Now, if you have a permanent crown that keeps popping off, a couple of reasons for that. Number one, again, the glue got washed from underneath. And that's why we recommend for you guys when you go home with a permanent crown or something that we just cemented on to be very, very careful not to drink anything hot for about an hour because the hot liquid tend to keep the glue very liquidy and then you'll wash it off from underneath the crown and off the tooth. One of the reasons that I have noticed over the years why a permanent crown come off is I'm always suspicious of a cracked tooth. And the reason why, when the tooth has a lot of micro cracks that's sitting under the crown, you have a lot of leakage of some of the internal fluids that feeds into the tooth. And you cannot have a very wet surface under the glue or under the cement because it will not adhere to the tooth. And that's one of the reasons why the crown will pop off. So over the years, I had one particular cases that constantly the permanent crown will come off. And then by troubleshooting and also by consulting with a endodontist, which is root canal specialist, that's what they taught me. If it's the tooth, then the tooth is cracked. If it's the deficiency in the quality of the crown, then we have to remake you a new crown. But typically what we do, we try to re-cement that crown a couple of times in order to go through the process of elimination to see if it's cement, if it's the tooth, if it's the crown itself. Those are the 3 factors that dictates the retention of any crowns. All right, next. When do I need a new guard? If you guys refer to my video of night guards, I always tell my patient, and I said it in the video, that I rather you guys break a guard, crack the guard, or chew through the guard than to do it with your own teeth. Because think about it, if you damage a guard because of your habit of crunching and grinding, then that tells us a lot about how strong your jaw is and how severe those habits are. But when you guys crack a tooth, that's super expensive, number one. Number two, sometimes you will crack the tooth from clenching and grinding, and we might not be able to save the tooth. So I rather replace a night guard with a new one. It's cheaper and it's a lot easier process than rebuilding a tooth or reordering a tooth or implanting a new tooth because you cracked the tooth and the tooth is not salvageable. So when do you need a new guard? if the guard is split and it's not stable when you insert it, it rocks on you and it's not held together. It's different than if the guard is worn down or there's holes in it. That has to be evaluated, because if you bring down the dimension of the guard, then the guard won't be able to support your clinching and grinding habits, and as a result won't be able to protect you as well. I hope that answered that question. The next one is, how long whitening lasts? That's a really good question, and we get that a lot. So when you do whitening, it really depends on the shade that you started with. So you have some patients have yellow undertone or the shade of the teeth. You have yellow, brown, or gray. And again, refer to my Zoom or my whitening video on YouTube. So if you whiten and you're, for example, a yellow undertone, you're going to brighten up very, very well. How long that's going to last, or how long does that last, depending on your habits and depending on your chemistry. What that means is, if your chemistry is very dry, you tend to be on the dry side and you don't drink a lot of water, or you are taking medications that can cause a dry mouth, then the enamel gets dry. The drier the enamel, the more or the higher risk of your capturing on stain, and the faster you catch on stain. If you are lubricated or very well, or you hydrate it very well, you have a higher chance to maintain. That's Bruno, my cat. He might jump on the couch while we're talking. Then the color will last a lot longer. Another thing that the patient will do, knowing that maybe they are brown undertone, or they are smokers or wine drinkers or coffee drinkers, or they are taking, like I said, medication that makes them mouth super dry, then they will make sure that it can touch up with the whitening with the prefab trays that we have, or if they have Invisalign retainers, they can use the tube of bleach or whitening that we give you guys after you finish Invisalign case, and you can whiten with that. But how long does it last? There's not really there's no straight answer to that, because everybody is different and everybody's chemistry is different and everybody has different shades. So if you start, like I said, if you start with a yellow undertone, you end up really, real bright. But if brown undertone, you get brighter, but you're not bleach white. And the gray undertone, that's the hardest one to bleach. We have time for one more question. The last question of the day, do I really need a filling? And I think I need more than video. Come here, Bruno. More than one video for me to answer that. I am very conservative restorative dentist or general practitioner, because decay has so many different patterns, and decay has so many different stages also, and sizes. So it really, to give a straight answer to that, there's no straight answer to that question. In order to figure out whether you need it, nobody wants a filling, but if you need a filling, is only by trusting your dentist or making sure that you are doing everything that you can to catch that cavity before it causes any pain. So I guess it depends on how your provider or the dentist works, what kind of practice, are they very conservative or very aggressive? And I get a lot of second opinion for that. Like, I had the other day a patient that she was told that she has 5 cavities, and I looked at her x-rays, she doesn't have 1. So not every shadow is a cavity, and that's how I explain it to the patient. And not every cavity or not every brown spot needs to be filled or needs to be cleaned. It has to be active decay. The way we diagnose decay, number 1, the tooth has to be super soft. That's the first sign. Number 2, if there's sensitivity, especially to sweet, not to preservative, not to sweeteners, to actual sugar. Number 3, it will be that the tooth is broken down, and there's a huge access that we can see in the mouth, the food constantly getting stuck in there, and you need to clean that out. But unfortunately, I'm out of time, so I can touch base. I'm sure I'm going to be touching base on that a lot because that's the bread and butter of dentistry, and that's how tooth damage starts, is by early decay too. So again, I hope you guys enjoy this, and I hope these answers shed a little bit of light on the most common questions that we get all the time, whether from patient to hygienist or from patient to us, the dentist. So that's it for now. Thanks for watching, and I'll catch you in the next video.